Hello.
Hi.
Hi. It's been a while.
Yeah.
How are you doing?
Well, I tripped and fell, and my wrist is really bothering me now.
I'd shake your hand, but you look pretty miserable.
Yeah.
All right. And you met Ben, my scribe.
Oh, yeah.
Okay. Well, tell me the story. What happened?
So I was walking on my way to work. I was wearing heels, and I tripped, fell. I fell like this, but with my right hand to kind of brace myself, and my wrist has just been bothering me since then.
And you got a cut on the left side as well?
Yeah.
How did that happen?
That was from the same fall.
Oh, jeez.
Yeah.
Did you hit your head?
No, I didn't hit my head. Just fell on my arm.
All right. And you didn't have any trauma to your chest, your belly?
No, just embarrassment.
You're able to get up and walk?
Yeah.
Okay. No more heels for you.
Yeah.
All right. And do you have normal sensation in your fingers?
Yeah. It's all been feeling normal, just painful.
Okay. So if I touch your fingers here, you've got normal sensation here.
Mm-hmm.
Can you give me a squeeze? Big squeeze. Good. Good.
Mm-hmm.
And spread your fingers out nice and wide. Fight against me as I push in here. Good. And try and crook your thumb for me. Good. Now push out. And I want you to hold your hand still. And I know this is going to be uncomfortable. I'm sorry, but try and fight against me. Push, push, push. Good, good. That's fine. That's fine. You have normal sensation over here, the back of your hand, and your thumb and your pinky finger.
Yeah.
That all feels normal.
Yeah.
Good. Okay. Well, I see a bunch of swelling around your wrist here, and you fell. So you fell forward and you tried to catch yourself. It looks like you did catch yourself with your right hand.
Yeah.
Maybe your left hand missed, and that's why you have this cut on your left arm here.
Yeah.
Okay. So I'll look at that in a second.
Okay.
All right. So then she's got normal capillary refill in the left hand. Radial, median, and ulnar nerve function are normal, both sensory and motor. Does this hurt?
Yeah.
If I try to bend the wrist, does that hurt?
Yeah, it does hurt.
All right, so pain limits range of motion of the right wrist, and there's swelling, particularly on the dorsum of the right wrist. Does your elbow hurt?
No, not really.
All right. And this pain, does it spread up along your arm, or is it confined to the wrist?
It's mostly the wrist.
Okay. Let's have a look. Can you flip it over for me? All right, so the volar aspect is normal, and the skin is intact. Let me bend you at the elbow here. So full range of motion at the elbow and the shoulder. Good. Full range of motion at the shoulder. And this bone isn't tender at all.
No.
And the shoulder isn't tender.
No.
Okay. And this side, do you have any tenderness here?
No.
All right. So there's looks like a 5 centimeter laceration to the subcutaneous tissue in the dorsum of the left forearm. Turn it over here. 2+ radial pulse on the left. Normal capillary refill on the left. Can you squeeze? Good. Now spread your fingers wide apart. Now hold your hand still.
Okay.
And push, push, push. Push against me. Good. So radial, median, and ulnar nerve function, sensory motor are normal on the left. All right. And your legs are working normal?
Yeah, my legs are all
Normal
fine.
sensation here. No swelling or deformity in the lower extremities. I
No.
want to feel your spine, okay?
Okay.
Does this hurt?
No.
Does this hurt?
No.
So your whole back is normal. Good. Let me just real quick listen to your heart and lungs. So skin is warm and pink. Heart rate and rhythm are normal. No murmur, gallop, or rub. Take some deep breaths. There's no respiratory distress. 2 more. And lungs are clear to auscultation bilaterally. All right. Well, I'm worried you might have broken your wrist. Let's put you in a splint right now.
Okay.
So if you can, hold your hand out like this.
Okay.
And this is just temporary until we can get a better splint on there.
Okay. So what's the next step then?
Alright, now that the splint's applied, what I'd like to do is get some ice on here. Let's take some x-rays.
Okay.
Right? And then we should probably numb up this wound and clean it out really well and stitch it up.
Okay.
Okay. And then you might need to see our orthopedist, Dr. Febinger,
Oh, really?
sooner rather than later.
Okay.
Okay, so hang tight. Let's get the x-rays and get some ice on there.
Okay.
I'll be back in just a minute.
Sounds great.
Hello, Dr. Febinger. This is Dr. Hurwitz over at the Family Practice Clinic. Yeah, so I have a young woman in her 30s who comes in today after a Fuchs type of fall with injury to the right wrist. She appears to have a Colles fracture. The ulna's fine on the right. She's neurovascularly intact, but I noted about 20 degrees dorsal angulation of the distal radius. So I put her in a splint. She's too tender for me to reduce it in the clinic. I think you should take a look at it this afternoon. Yeah, so as I said, neurovascularly intact. She does have a laceration on the left forearm, which I repaired in the office. She's otherwise healthy. Yeah, good. So I'll send her over today. I appreciate it. Thanks a lot. Hi.
Hi.
Okay, well, I've looked at your x-rays,
Okay.
and you have what we call a Colles fracture,
Oh. Oh no.
named after Dr. Colles.
Okay.
So this is a fracture of the radius bone, which is the big bone in the wrist,
Okay.
the one on the inside.
Mm-hmm.
Your, what we call the distal radius, so the end of the bone is angulated about 20 degrees backwards, so dorsal angulation
Okay.
of about 20 degrees. And there's some soft tissue swelling along with that, which we see on exam.
Okay.
And the ulna bone, so the bone on the outside, looks fine.
Mm-hmm.
The carpal bones, your wrist bones, all look fine, and the
Okay.
hand bones look fine.
Okay.
Okay, and the joint itself looks to be intact.
Okay.
So this is a kind of injury that may need surgery.
Oh,
And
wow,
you may,
really?
Yeah, you may need Dr. Febinger to push on that bone and get it back into place in the meantime. So I'm going to have you see him today. And
Okay.
I've called Dr. Febinger and we've had a discussion about this injury, and he wants to see you this afternoon.
Oh,
You'll
okay.
be able to go there at about 3 p.m.?
Yeah, that works for me.
Excellent, good. So, let's tend to this wound. What I'd like to
Okay.
do is inject some lidocaine,
Okay.
okay, and then we're going to use 1% lidocaine without epinephrine. And let's do that. So, and once again, you don't have any allergies to medicines, right?
No.
Alright, so let's take this wrist. You'll feel a pinch and some burning, and you'll see it swell up a little bit. You gonna be okay?
Yeah.
Alright.
Okay.
Pinch. And some burning. You doing alright?
Mm-hmm.
Pinch. Burning. You should be pretty numb by now.
Yeah, it does feel
Do a
numb.
little bit more inside the wound. Good. So that was 6 milliliters of lidocaine.
Okay.
And now I'm going to inspect it a little bit. So I want you to Just drape your arm right here.
Okay.
Okay. So I see a 5 centimeter laceration that involves the deep subcutaneous structures. I don't see any tendons or other structures within the wound. I don't see any foreign bodies, and the field is bloodless. There is minimal bleeding. Let me take a closer look inside here. Okay. I'm going to have the nurse come in, wash it out pretty good,
Okay.
and then I'll come back in and we'll stitch it up, all right?
Okay. Sounds good. Thank you.
Thank you. Did we irrigate it?
Yeah.
Excellent. So the nurse used about 1 liter of normal saline,
Okay.
and it looks good. So let's do some stitching. My gloves here. You doing okay?
Mm-hmm.
All right. This is numb?
Yes.
Excellent. All right. Looks as though you were never injured.
Thank you.
So these stitches will stay in for 2 weeks, and you'll come back here and I'll snip them out.
Okay.
There are 5 stitches in there.
Okay.
You want to keep them clean and dry, except put Neosporin or bacitracin, whatever you have on there, twice a day. Inspect the wound twice a day. Make sure you don't see any redness, swelling, drainage, bleeding,
Okay.
no severe pain, no fevers, anything like
Sure.
that happens, you got to come back here or go to the urgent care or the emergency department right away.
Okay. And can I? Do I need to cover it when I shower or?
For the next 24 hours, yes, and
Okay.
then after that, no.
Okay.
Okay. Don't really scrub it for the next several days, let's say 5 days. Just kind of, you can get it wet, and maybe gently soap it, but no real scrubbing. Okay.
Okay. Sounds good.
And we're not going to start any antibiotics today.
Okay.
And let's have you take ibuprofen, 600 milligrams, 3 or 4 times a day if
Okay.
you're having pain.
Okay.
And keep it elevated may help.
Okay. Sounds
Do you
good.
have any questions about that?
No, I don't think so.
Alright. Well, let's have you scoot on to Dr. Febinger's office at 3 p.m. then,
Okay.
and
Perfect.
he'll communicate with me whether or not you need surgery, and we'll have you follow up with me based on his recommendation. You'll probably see him afterwards as well.
Okay. Will he do the surgery today or?
I don't think so, not
Okay.
today,
Okay.
but he may want to push on it today and get the bones back into alignment.
Oh, okay. Okay. Sounds good.
All right,
All right.
so it's nice to see you again.
Yeah, nice to see you too.
Watch it with the high heels.
Okay.
So Ben, if you wouldn't mind printing out her after visit summary, and we'll see you next time you come in.
Okay, thank you, doctor.